All right, look, if you're watching on the YouTube channel, you see something different. I'm not wearing glasses. First time in almost 20 years, I am able to not wear readers. It has been an incredible experience, and I credit that to K2 Vision and Dr. Kopstein and his team. They did such a great job with the refractive lens exchange. I knew I wasn't seeing very well. I had big font on my phone. I couldn't read on a page without glasses, the flashlight at the restaurant, everything that everybody else was doing. And then I went and had the exam and they explained refractive lens exchange. It has been life-changing for me. 2 days after the procedure, I have not worn glasses since. It changed everything. On my computer screen, on my phone, menus at a restaurant. It is back to the vision I had when I was younger. And the best part is I will never develop a cataract. It is an incredible experience. Just go to k2visionrle.com. It's going to change your life. k2visionrle.com.
I'm going to have you, Joe, to tackle the next question. It has to do with astigmatism. So do these, I guess, first of all, what is astigmatism? Because people may not actually know what it is. And do these procedures treat it, please?
Sure. An easy way to think of astigmatism is the shape of a football versus the shape of a basketball. A basketball, of course, is spherical, but a football is steeper in one meridian than in another. And the cornea can be shaped like that as well. So when correcting astigmatism with refractive surgery, we have a number of different techniques. If we're doing a LASIK procedure or a PRK procedure, we can have more laser treatment performed in one meridian than in another, for example, vertically versus horizontally, depending on the axis of the astigmatism. With an ICL or a refractive lens exchange, there are lenses that can be inserted into the eye that correct astigmatism. So these astigmatism correcting lenses are known as toric lenses, and they need to be aligned to the axis of the astigmatism in order to appropriately correct it. So depending on the technique that is being used to correct the vision, we are able to correct astigmatism. One other technique that can be used, sometimes some incisions can be placed in the cornea to help change the shape of the cornea, to help relax that steepness. So we always plan to leave a patient with a minimal amount of astigmatism. It's most often that we're able to fully correct that astigmatism. Once in a while, a patient might need a touch-up, which can be done following the procedure. Typically, touch-ups are for about 1% to 2% of patients who have a LASIK procedure done after about 12 weeks. For PRK, it would be done typically after 6 months for patients who have a light adjustable lens, which Dr. Kopstein will talk more about shortly. The astigmatism sometimes can be addressed in the immediate postoperative period. And once in a while, a patient who's undergone a refractive lens exchange might have a laser vision correction procedure performed to address any residual prescription. So astigmatism can be treated. We always plan to get rid of it because we want everyone to see as well as possible after these procedures.
I'm most excited about being able to see without thinking of anything else, whether my eyes are dry from contacts, whether my glasses are there and within reach. Just being able to function without thinking about it, that makes me excited. The staff here at King LASIK has been super accommodating, super friendly, and really informative. So during the whole process, I have been walked and told what every step is going to be. So I felt very much part of my care and part of the team in that regard. I can see the writing there. I never would have been able to see that. I wouldn't have been able to see your face. I would have been able to see a blob in color. I can see people's faces. I can see signs. As soon as I got up off that table, honestly, I feel like it took like 5 minutes. I'm very excited about not having to wear glasses again or having to worry about contacts either. I can just open my eyes.
Since surgery, I have found a new zest for life because I'm not stressed out. I'm not stressed out about contacts, drying up, scratching my eyes, or my glasses falling off and or fogging up. I get to just live. I've been loving everything about the EVO ICL, and I can't recommend K2 Vision King LASIK any more than I already have. All in all, I'm just incredibly happy with the results.
I was extremely nearsighted. My left eye was about -9, and my right eye was about -5 with astigmatism. So I had kind of wonky eyes. My eyesight was such that if I would hold my hand up in front of my face about this far, maybe about 6 inches, it would start to get blurry. I am very much a planner and researcher by nature. I looked at everything under the sun, and I chose King LASIK specifically because the surgery was easy, so to speak, for him. I wanted to go to someone where this was extremely routine, and I had read about Dr. King doing ICLs for the military. He probably still does them, but I know he had kind of gotten to start doing a lot of those in the military, and so I liked the fact that it was easy for him. Life has gotten a lot better. Just simple quality of life. I'm not having to, deal with my glasses anymore. And this is what I had beforehand, kind of these big chunky ones, and especially with my right eye, these really god-awful thick lenses that I'm constantly having to push up and cleaning my lenses. I don't have to do any of that. One of the most fun things for me was being able to just grab a pair of sunglasses, right off of the store rack. I wasn't having to find clip-ons or pay a lot of extra money to get prescription sunglasses. It's fantastic. I would really, really recommend it to anyone who, has vision like me, where you're thinking you're kind of chained to thick glasses or contacts. Recovery was not bad at all. So I came in on a Friday. I was able to go back to work on Monday. It was remarkable. I opened my eyes and I wasn't reaching for my glasses. I wasn't squinting. I could see. It was just incredible. Absolutely incredible. A new, kind of my eyesight, I'd been given new eyes, so to speak.
Hey, Jim Sharp here to tell you about what happened to me at K2 Vision RLE. It's practically miraculous. I don't have to worry about wearing readers anymore. I don't have to worry about picking them up at the pharmacy. And for me, somebody who's on the radio, I read a lot, and having to take my glasses on and off constantly, I just can't live like that. You want to live like this. The benefits are amazing of having a refractive lens exchange at K2 Vision RLE, where the surgeons have done 150,000 lens procedures, so they know if it's right for you. After having refractive lens exchange at K2 Vision RLE, I don't have to worry about the readers. I don't have to worry about the kind of glasses that you sit in the chair for this every year either, the distance vision glasses. And I don't have to worry about ever getting a cataract because it's not possible after having refractive lens exchange. That's the RLE and K2 Vision RLE. You want to live like this too. In fact, my wife's very, very jealous. We're going to get her in soon too. K2 Vision RLE.
Hi, I'm Nick, the public address announcer for Seattle University basketball. And for the past 13 years, I've been able to sit courtside and be on the mic, and it's definitely my happy place. But for the last 9 of those, I've had to wear reading glasses for every single game. This past year, I turned 60 and decided it was time for a change. So I went online to myk2vision.com and booked a free consultation with Dr. Kopstein. He was wonderful. He answered all my questions, relieved my anxiety, and I booked my procedure for 1 week before our home opener. On the day of the surgery, I had both eyes done. It was quick, it was absolutely painless, and I went home with a guarantee of never having to deal with cataracts for the rest of my life. Thank you, Dr. Kopstein and the K2 Vision RLE staff. I can now scan the scripts, read the rosters, and every time I get to say, K2 Vision RLE, a proud vision partner of Seattle U Athletics, it puts a smile on my face. Go Red Hawks!
So when I did the eye chart for my bad eye, I was like, it's just a white screen of haze, there's no letters. And she kept clicking and clicking and clicking. Finally, she filled the entire page with one letter. And I had a little difficulty telling an H from a K. Today I can read the bottom 2020 line. I can read it without it's unbelievable. And then of course, forget about color clarity. I don't have them, and it's only been 24 hours, which is amazing that I can see as well as I'm seeing. But that when I use my reader, I can see the dots on the pixels. It's so crystal clear. I can see the pixels of the computer screen. Okay, so.
Well, tell me, how was the surgery itself?
Exactly as they described. You feel really nothing. They walk you through and talk you through everything. I had complete confidence, and exactly before you know it, he's saying, you're done. You're done. I'm like, and I sat up and didn't have to wear a bandage. I could see right away. So I didn't want to cry because I wasn't sure if tears were going to hurt anything, but there's no way I can be happier with the result. It's astonishing that I can read, and I got the letters right, the whole bottom line. It's unbelievable. So yeah, I'm super proud. Also, the bedside manner of each and every person in this outfit is top notch and compassionate, and they totally understand what you're facing and put you at ease. And the massage chair. She wants that massage chair. So.
Awesome.
But what about those people that have had LASIK? Can they have refractive lens exchange, please?
LASIK, as Joe described, LASIK is done on the cornea. That's the front part of the eye. It doesn't change the fact that your lens inside your eye is going to eventually lose its function and become a cataract. So the answer to that is yes. You can have refractive lens exchange at any point after that lens begins to fail. The question is when to do it. And that answer is different for every patient. And it's really important to know when you do have your lens exchanged, what should I exchange it with? And what are my expected outcomes? So if you've had LASIK before, it's not that you can't have a multifocal implant that gives you distance intermediate near vision on day one. It's that it's a high risk of not having really great distance vision. So we actually try to shy away from putting multifocal lens implants into patients' eyes if they've had LASIK before. We just know that we're adding aberrations to the visual system that are bothersome to patients, mostly for distance vision. So if you had LASIK, you're probably really happy with your distance vision, and you really don't want to give that up because you've just gotten your lens removed. What we want to do is improve that distance vision and give a range of focus for near vision. And that's where the light adjustable lens has come into play. And that's been a real game changer for all refractive lens procedures, whether it's cataract or before cataract.
Now, where is the Vision Quest taking me? Hi, it's Cartier for K2 Vision RLE Refractive Lens Exchange. Behind me is Granada, Spain. Currently shooting this video from La Alhambra, World Heritage Site. Way to go, UNESCO. They know what they're doing. And so does the surgeons at K2 Vision RLE. They've done over 150,000 of refractive lens exchange procedures. They'll know if refractive lens exchange is right for you. All of your pertinent questions answered during a free Zoom consultation at k2visionrle.com. At the end of the procedure, no glasses, no readers, no cheaters, no contacts, never ever changing a prescription, and never ever a cataract. Schedule your free Zoomer today at k2visionrle.com. From La Alhambra, World Heritage Site in Granada, Spain, k2visionrle.com.
I had a RLE procedure done with Dr. Kopstein about 2 weeks ago. And at this point, I've been very satisfied with the results. At my initial consultation, or I should say from the initial consultation to actually having the procedure done to the follow-up, everything was easy. There was no stress. They were very thorough with what they did. My vision went from probably close to 20/40 to 20/20 literally the next day. And it has improved every day since then. I'm very happy with what has been done, and I would recommend this procedure to anyone. It is incredible the amount of change that I've noticed. Knowing that I was probably going to have to get prescription glasses in the next couple of years, which would have been part of the aging process, but I have talked to people that have had this done, and they've all been very satisfied with the results, and that was the reason I wanted to do it. Yeah, everybody here, it makes you feel completely comfortable. There is no pressure. Myself, I'm actually very comfortable having procedures, or when it comes to surgeries and things like that, I trust the professionals. I don't know how you could be any more accommodating than what these folks were. I would recommend this to anybody if you have some fears or some, trepidation of having a procedure like this done. Please go to the consultation, and those will all go away. You will be very happy with the results. What this has done is given me the freedom that I will not have to keep searching for my readers that are staged throughout the house in every room at this point, and I will not have to go to the local pharmacy and pick up a 3-pack that I will inevitably break or lose. That's what I'm looking forward to the most from this procedure.
We got a question here from Charlie, which is after RLE is done, if the body doesn't adapt to the new lens, what to do? Does it happen most of the time? Not like how often does that happen where potentially the body doesn't adapt to the new lens?
Well, the part of the body that we're talking about is actually right here. I always tell patients that I really wish I could be inside their brain and seeing what they're seeing, and know if they're going to adapt to the technology on day one. I have a pretty good idea after talking to patients about what they can tolerate and what they can't tolerate. But in general, with the multifocal lens, 95 to 99% of people will tolerate the design of the lens, which involves rings. So all multifocal optics have some kind of a ring design. So do you have that? Do you have a sample, Michael, of multifocal that
I
you're
don't have a sample, but I can probably get one up if
Okay, well, yeah.
Christian does maybe.
Okay. So these rings are actually part of the lens. The ring design of the lens will focus incoming light from distance, intermediate, and near. And most people tolerate this lens design just fine. In fact, half of the patients with a PanOptix lens will never see the rings, but half of the patients will see the rings on day one. If you ask those same patients 2 weeks later,
Any of these you want to have me
Yeah.
to zoom in on?
Yeah, well, any of them. Yeah, the Johnson, just pull up the Johnson & Johnson one from Carrier Seal there. Yeah, so this is a Johnson & Johnson lens, but all of the multifocal lenses have this concentric ring design. And when it's in your eye and you're looking through that, the question is, am I going to see those rings? And they're all a little bit different, but I'll talk about the PanOptix lens because that's the lens that we use most commonly, because it has the lowest incidence in my career of patients being bothered by the ring design. So what might you see? Well, when you're looking at a light when you're driving at night, you might see these discrete concentric rings around each headlight. And the question is that going to bother you? So we ask you at 2 weeks, do you still see the rings? At 2 weeks, that 50% goes down to about 10%. And at 3 months, it goes to about 2.5%. So after 2.5 months or 3 months, if you're seeing rings around lights, we're going to ask you, does this bother you enough to have the lens removed? Because the only thing you can do in that case is remove the lens and replace it with a different type of technology. And in our series, about 1 in 100 patients just will not adapt to the ring design of the lens. We know that's going to happen about 1% of the time. And the remedy then is taking the lens out and replacing it with usually a light adjustable lens that has no ring design on it.
Dr. King, I'm going to have you just speak about, and you can provide, the question will be like, how long do these procedures take and what's the experience like? But for those people that maybe are in that LASIK crowd, let's kind of talk through LASIK, ICL, and refractive lens exchange. So you can kind of have them all in the same bucket, but how long do these procedures take and what will people be experiencing? Any pain or does it hurt or any of these for all three, please?
All of the refractive surgery procedures are short. They all will take typically 10 minutes or less. LASIK is a very fast procedure. Both eyes can be completed in about 8 minutes, and that's the same for PRK. A patient will walk in, lie down, the procedure is performed, typically for the right eye first, followed by the left one. And after about 4 hours of healing, LASIK patients begin to feel pretty good, and the vision really clears up, and by the next morning, nearly every LASIK patient is able to see clearly 20/20 or better. With PRK, it may take about 3 or 4 days. For an implantable lens, the ICL, typically the healing is very rapid. It's not unusual for our patients to be 20/20 the same day. We typically check ICL patients a few hours after the procedure. So very quick recovery for these. Same thing for the refractive lens exchange procedures. These are also very fast procedures, typically taking about 10 minutes or so. The recovery is very quick as well. It may take a few days for the best vision to really come into focus as corneal edema, if there is any resolves or any postoperative inflammation, but nearly all patients are functional and doing well within 24 hours.
All right, I'm going to show you why I love RLE and Dr. Kopstein and my K2 Vision. So I'm backstage right now. This is the Chesapeake Bay wine auction. They'll have about 1,500 people here. This is why I love the fact I don't wear glasses anymore. Watch this, you ready? Okay, so this is the stage. This is where I stand. Look how far away everybody is, right? When they all sit down at those tables, they're holding little paddles about this big. And I can see every number, every number, every number. And I don't have to wear glasses. Thanks, Dr. Kopstein. RLE. MyK2Vision.com. Life changer. Get high.
Michael, I just wanted to add that I just saw all my post-ops from yesterday, just this morning, and all of them drove in without glasses themselves, except for, I think, one patient. So that's more common than not, that you're driving yourself the next day, the next morning. That's our expectation, at least.
Hi, my name's Val. I'm 59 years old. I, like so many others, have been dependent on a bifocal for both near and far for probably the last decade. I underwent RLE procedure late October 2022, and I can say since that procedure, I can see near, I can see far, I can see my computer, I can see the dashboard of my car, I can see better for night driving, and I can honestly say undergoing the RLE procedure was the best choice I've ever made. The only glasses I wear are my sunglasses.
How has your life improved since undergoing RLE with K2 Vision?
Actually, my life has improved so much, and I will start with the fact that my entire life I did not have very good vision. I had glasses from grade school on, and of course, with the aging process, it got progressively worse, and made the decision to do this. And now I'm getting the opportunity to see things that I'd kind of given up on seeing. Traveling's different with my husband. He used to say, look at, and I couldn't even see it, just be like, and now I'm the one saying, oh my gosh, look at. So that's totally different. I've also had the opportunity to do a couple of projects with my granddaughter in low light situations, and that would not have happened before.
What was the recovery process like for you?
I had actually, probably in comparison to others, a long one, just because I needed so many adjustments. My right eye, when I came in, the comment was made, had I ever actually seen anything through my right eye? And so there was quite a few adjustments, but when it was finally dialed in, I could rejoice in being able to see things that I couldn't see. So it was a few weeks longer probably than the average, but within a couple of months, I was where I wanted to be.
Is there anything you'd like to share with others considering surgery based on your experience?
My only regret is that I didn't do it sooner. I did hear about it probably about 5 years ago, and it wasn't until the last 6 months that I did the homework, the actual homework on the process and what it entailed. And my regret is the fact that I didn't do that homework 5 years ago and do it then.
I want to acknowledge that anybody having, well, really any surgery, but particularly eye surgery, there's a fair amount of anxiety in proceeding with this. I have watched Dr. King do, I don't know how many LASIK surgeries, but you literally have nothing to worry about in terms of, there's two things. There's physical skill, there's the it factor, and all of that relates to experience. You can't, I don't think you can find a LASIK surgeon who's more impressive than Dr. King. I know, he's my partner, but honestly, what he does is amazing. He's at one with his machine, and it's really an impressive thing to see. And I've done tens of thousands of LASIK procedures myself. I've never seen anything better. Experience in being inside of the eye is a little bit different. There are surgeons who've done tens of thousands of procedures. The important thing there is that not everybody's eye is the same. There are potential risks that you have to really be tuned into, and you have to be able to react to very quickly. And if you've done 50,000 procedures, you've pretty much seen everything and you can anticipate everything. It's rare that a surgeon like myself or Dr. Schlecht or any of our other surgeons are surprised by things when they're actually doing the surgery. The second part of this is with the experience is that we really obsess about data and outcomes. And I, in particular, really obsess about anybody who expresses dissatisfaction. So I've gone back and looked at anybody who might feel like they didn't have the outcome that they really wanted. And I have a really good idea of what not to recommend for somebody based on our past experience and looking at that. I love sharing data, and I think that's something that we can really offer that it's hard to find in terms of following patients afterwards and knowing what their outcomes are for each of these technologies. And I think every patient who is taking the risk of going through an eye surgery deserves to really know what the data and the outcomes are.
Hey, this is Jim Sharp, and I was a kid who had to wear thick glasses, which is awesome. Then I grew into a lazy adult who didn't want to deal with contacts, so I had LASIK, which is great. But what you might not know about LASIK is you still may need glasses eventually. And guess what? I grew into, well, at least what looks like an old man, because I needed reading glasses. But I don't anymore, thanks to Dr. Kopstein at K2 Vision. He's performed more than 50,000 procedures. Get your free consultation by going to K2VisionRLE.com.
So where am I now? Hi, it's Cartier for K2 Vision RLE Refractive Lens Exchange. This is a moment for me why I had refractive lens exchange surgery done. The later years of my life to take in scenes like this. This is Bled in Slovenia. Catch all of the splendor in a way that you never had a chance to do before without glasses. At the end of this rainbow with K2 Vision RLE, no glasses, no contacts, no prescriptions, and never, ever a cataract. It was the perfect permanent solution for me. I get a chance to see things like this, crystal clear. K2 Vision RLE. Schedule your free Zoom consultation now, and then go on a vision quest.
The first consultation was eye-opening, as you might say. I didn't know about the refractive lens exchange, and then I started thinking, wow, this is a great possibility. And it said you can get them both done in one day, both eyes, and I'm doing some really delicate, precise woodwork, and I got to see these lines, and the lines are double, and I'm going, oh man, this is hard. It's getting harder to do my job, and I was feeling a little bit feeble. It was completely different. I was going to do that same kind of work that I was struggling with, and I'm seeing it. It's good. I don't have to struggle, and I mean, ever since I've had it, I'm just bragging about my new eyes. I was sitting in that Sunday school class again, and sitting in the back because schedule had changed, but whatever. A few weeks later, I'm sitting in the very back. I raised my hand. I'll read those scriptures there. And I was able to read it. Everybody in church knows that I can't see very good, but I was able to read the whole thing from the back of the church. It was great. It dawned on me during all of this, and just right after, when I was going to the back to the appointments to follow up, that Dr. Kopstein said, this is the rest of your life. You don't have to redo this again. And that took a while to sink in, but it was part of, I mean, it's given me freedom. I've thrown away my readers. I don't need those at all. And I can just have confidence that I can see stuff without the complications of having to find some glasses or pull them out or figure it out. So the RLE is amazing, and it's like I keep telling everybody, I have new eyes, and it's the rest of my life.
I got a question here from Christine, which is, how does the light adjustable lens work, and what does it do? Like, so just, and then coupled into that was somebody asking the question of, can you revisit I've had LASIK, why is the light adjustable lens the best option? So thoughts?
Yeah. So if you've had LASIK before, that means that your cornea the shape of your cornea has been changed. And we know that when we add the cornea change to a multifocal lens, you have a much higher risk of being bothered by those rings to some degree for some reason. So we will almost always do a light adjustable lens in patients who've had previous LASIK. And what you might ask is, well, why don't you just do the light adjustable lens for everybody? And the reason is that the light adjustable lens will give you distance, intermediate, and near vision because it has a very high depth of focus, and we can fine tune it after the surgery to get all of the incoming light focused onto the retina in the back of the eye. For 38% of patients, when we adjust both eyes for distance, they have all the distance, intermediate, and near vision that they want. That's not close to 100% like PanOptix, it's 38%. The other 62% of patients will achieve their near vision by adjusting this lens once it's in the eye. So again, this is a lens that has no rings, it has a wide depth of focus and tremendous light transmission. So quality of vision is fantastic because there's no ring design, there's no contrast reduction. It transmits light like a 5-year-old natural lens, right? So there's your light adjustable lens. There's no rings. It has a depth of focus to it that allows 38% of people to have maximum distance vision and still read. But 62% of patients will require a further adjustment to gain the reading. When we do that, we typically start with one eye. The reason we start with one eye is that we don't want to give up distance vision in usually the dominant eye. We want to maintain that distance focus in at least one eye, and then start to adjust the light adjustable lens to the point where the patient says, I have all the reading vision that I want. And then we wait about a week, and 90% of those patients, of the 62%, they'll come back and they'll tell us, this is great, lock in the lens, and we lock it in, and that's the vision for the rest of your life. 10% of patients will come back after that week and they'll say, I don't like the difference between my two eyes. And in that case, we really have two options. We can either adjust it back so that both eyes are max for distance, or we could give up a little distance vision in the dominant eye to match the eyes for the desired near point. And those are patients who might not be 2015 or 2020, they might be 2025 or maybe 2030 for distance vision, but they have all the reading vision that they want. Some patients will tolerate that. Most patients will have, they'll want to have their best distance vision and then wear reading glasses occasionally. But 90% of patients who have a light adjustable lens in both eyes after lock-in will not need glasses for anything. 10% will say sometimes I have to wear reading glasses. That's different than PanOptix. The PanOptix lens, the ring design or multifocal lenses, there's virtually nobody who has to wear glasses after the PanOptix lens. And that's by virtue of the ring design. So if you're a candidate for that, and that's your priority to be glasses free forever, I'm always thinking about the PanOptix lens. If your priority is, I want my very best distance vision, and I don't mind if I'm in that 10% of people who sometimes have to wear glasses after this, I just want the very best distance vision. I know I'm at least going to see my computer and my cell phone, but I don't care if I have to put on a pair of cheaters to see something small, then the light adjustable is your best option. If you've had LASIK before, we don't even want to take the risk because we know it's very high that you'll have not optimal distance vision or suboptimal distance vision. So we usually move right to the light adjustable lens if you've had LASIK before, or if you have any other abnormalities of your visual system, or some people just have one eye and they have a lazy eye. Some people have had retina problems or strokes or other issues with their visual system. And we're typically going away from a multifocal lens in those patients because we just know our outcomes are not as consistent in those scenarios. So that's the beauty of the light adjustable lens. We can use this lens and fine tune it to exactly what the very best that the patient can get.
I'm most excited about being able to see without thinking of anything else, whether my eyes are dry from contacts, whether my glasses are there and within reach. Just being able to function without thinking about it, that makes me excited. The staff here at King LASIK has been super accommodating, super friendly, and really informative. So during the whole process, I have been walked and told what every step is going to be. So I felt very much part of my care and part of the team in that regard. I can see the writing there. I never would have been able to see that. I wouldn't have been able to see your face. I would have been able to see a blob in color. I can see people's faces. I can see signs. As soon as I got up off that table, honestly, I feel like it took like 5 minutes. I'm very excited about not having to wear glasses again or having to worry about contacts either. I can just open my eyes. Since surgery, I have found a new zest for life because I'm not stressed out. I'm not stressed out about contacts, drying up, scratching my eyes, or my glasses falling off and or fogging up. I get to just live. I've been loving everything about the EVO ICL, and I can't recommend K2 Vision King LASIK any more than I already have. All in all, I'm just incredibly happy with the results.
I'll tell you, one of the best decisions I ever made was listening
to Dr. Kopstein. He was at K2 Vision, and he was talking about how RLE, refractive lens exchange, can allow you to get rid of your glasses, get rid of your contacts, even if you're over the age of 50, which I gladly admitted to being over the age of 50, and I had all the glasses in the junk drawer for driving long distance and then seeing up close and reading the teleprompter and everything. Got rid of all of that. I went in to meet Dr. Kopstein, and I asked him a very difficult question for me anyway. I said, how many of these have you done? And he said, I don't know, probably, I don't know, maybe there were 100,000. I was like, okay, I'm in great hands. He explained to me how the procedure worked. He said, now listen, don't get too excited because this might not work for you and I don't want to do it if it's not going to give you the best results. I might tell you to come back in 5, 10, or 15 years. And I said, okay, take a look at my eyes. He does. He says, you know what? This is going to work for you. You got a little cataract in your right eye. We'll get that out of there. I go back in 2 days later, 5 minutes on one eye, 5 on the other. I come back in a day later. I've got 20/20 vision. Bang! No more glasses, no more contacts. You probably have lots of questions like, will it work for you? How much does it cost? All that stuff. You know what? Set up a Zoom consultation. This is the best way to do it.
So what made you choose EVO ICL?
It came highly recommended, and because of my really bad vision, I was really excited to be able to be free from my glasses and contacts and be able to see without even thinking about it. It's reversible just in case something down the road happens. That would just give me a little peace of mind, and I'm just really excited about clear vision.
Yes. And then what are you most, oh, that you just answered that. And then how has the process been for you?
It was really smooth. Everyone was so friendly and informative, and I got here and it was a quick procedure and I went home and I can see right away.
Awesome. And then do you have any advice for new patients?
Yeah, just do it. It was really easy. It's really going to help me out in my medical profession to be able to see really well and tiny things. And I'm excited to be able to use it there.
If you've had RK in the past, we haven't talked about that yet. Can you still have refractive lens exchange? What are your thoughts for Ken, please?
Is that a question for me? I certainly
sir.
can answer. Dr. Kopstein, feel free to chime in as well. RK was an older technique that preceded both LASIK and PRK. It was commonly done in the 80s and early 90s, and there were pie-shaped cuts made in the cornea with a diamond blade to result in relaxing incisions that would flatten the cornea, and it worked well to correct nearsightedness. However, that technique is no longer performed in any significant way because of the change in prescription that tends to take place over years. However, everybody eventually gets a cataract, and at some point, we need to start contemplating removing the lens from the eye. So for a patient who's had RK, it's very similar to a patient who's had prior LASIK or PRK. The light adjustable lens is really the best lens to insert because, again, we're dealing with a multifocal cornea, a cornea that is scattering light in some unpredictable ways. And if you put a multifocal lens like the PanOptix lens into the eye, you're just going to be asking for trouble. There's going to be a much greater chance of a person having glare or halos at night or dissatisfaction with the quality of vision. So the light adjustable lens is really the lens to use in that circumstance. And as I'm sure Dr. Kopstein will advise, there are some surgical techniques that need to be used to avoid letting those RK incisions splay apart during the lens exchange surgery. And these are just intraoperative considerations. Anybody who's had RK tends to have a weak cornea, so there tends to be a little more play in the prescription afterward, more fluctuation. And unfortunately, there's not really any great technique to lock that corneal shape into place. There have been some experimental strengthening procedures like corneal collagen cross-linking that's been done, but short of a corneal transplant, you can't really replace an RK cornea and make it normal again. But for most patients who have had RK, a light adjustable lens can provide very good quality vision postoperatively.
Dr. Kopstein, anything you want to add before I ask you the next question?
Yep, I would just add to that, Joe, that what I tell patients is that RK results in an unpredictable cornea. And what that means is that after surgery, we don't really know what shape it's going to be. This is why the light adjustable, so we have the largest case series of light adjustable lens implants in patients who've had RK in the world. And our data are actually very compelling with patients who've had previous radial keratotomy surgery. There's a method to adjusting this light adjustable lens once you know what the cornea is doing from morning to evening. And it might be different, as Joe mentions. Patients who have had RK will have fluctuations during the day. So you really have to know what the fluctuations are, and you have to be able to measure those before you can then go use ultraviolet light to change the shape of the lens to accommodate for those fluctuations. There's no other technology that allows us to do this except for the light adjustable lens. So I'm very grateful for this lens. I've done, cataract surgery on tens of thousands of patients who've had previous corneal refractive surgery, and the RK patients were always the most challenging patients to get quality vision and spectacle freedom after surgery. And now with the light adjustable lens, virtually all of our RK patients will tell us that they don't wear glasses at all anymore. So it has been a game changer in refractive lens exchange or cataract surgery for patients who've had previous RK.
All right, how are you feeling?
I'm feeling great. I'm very excited for the surgery.
Awesome. How long have you worn glasses for?
Oh my gosh. Probably since I was like 10.
Wow, okay. Well, let's take you back.
Great.
Okay, you did it. How do you feel?
I feel good. It was actually a lot easier than I expected.
Was it painful?
No, just the pressure and then the light show. Not painful at all.
Awesome.
A question about night vision, and so they have refractive lens exchange. Like, what maybe the crowd that's in at 55 and older, or 50 and above, what may they be experiencing with respect to their night vision, and what can they expect after having refractive lens exchange? An improvement, the same, worse? What are your thoughts on that, please?
Well, the reason we have problems with night vision is one of two things. It's either that the light is not being focused through the eye to the back of the eye properly, or maybe it's being scattered by the lens itself. So patients who are getting early cataracts would be a perfect example. When you put on glasses or contacts, if the problem is now that you focus the light to the back of the eye, but that lens doesn't have the quality to give it a good focus, then you're still going to have night vision symptoms. So when you're doing a refractive lens exchange, you're getting rid of the problem typically, which is that the lens it has lost its focusing power and might also be scattering light. So with all of these new implants, new technology implants, we can choose a power of the implant that will get the light in focus, so that will take care of the first problem. And then the clarity of the lens and the way that it transmits light is, for all of our patients who are certainly over 50, is a better quality transmission of light to the back of the eye. So both of those issues are solved with a new technology implant.
Hey, this is Jim Sharpen. If you ever thought to yourself, I'm having a little trouble reading what's on the page, I might need readers. Well, I never will need readers, thanks to K2 Vision RLE. I had a refractive lens exchange done at K2 Vision RLE. It's quick, it's painless, it's permanent. I'll never need readers now. And side benefit, I'll never get a cataract. And you know you can trust the doctors at K2 Vision RLE, not just because I went there, but because they've done 150,000 procedures. Find out more, get your free consultation. Click on the link. I tried to set it up so that, you could click on my eyeball, but I get it. That's a little weird.
Joe, if you wouldn't mind, let's talk about, so we could bundle in LASIK, ICL, and RLE on this, but what is, as far as like people getting back to regular activities and getting back to their life, let's sort of set the timeline of what's going to happen after any of these refractive procedures and how soon they go back to driving and working and whatnot, please.
The motivation for people to be free of glasses is generally the desire to enjoy freedom to perform their activities of daily living without glasses and contacts. Unfortunately, the recovery is so fast that most people within 24 hours are able to resume the vast majority of activities, whether you've had LASIK, PRK, ICL, or an RLE procedure.
Dr. Kopstein, do you want to talk through that process of what happens at the consult and how we help them to decide which lenses, and anything you want to talk about the lenses, please?
Yeah, the first thing that we do when you come in to see us is we dilate your eyes and I look at your lens. If the lens is obviously a cataract, then we proceed to cataract surgery and we talk about which implants might suit your lifestyle the best. In general, if your entire ocular system and your optic nerve and your brain are completely normal, you have every option available to you. And then it's a matter of really understanding what all of these technologies do. There's a rather long list of patients who should not get lens design A or B or C. So if you're not a candidate, for example, for a multifocal lens, we have a lot of those patients. We cross that off the list and we talk about the other technologies and what they do. Our goal is always to give you the best quality vision without glasses that's permanent for the rest of your life. And that's really all I do every day, actually. So,
Do you see that rainbow? The rainbow that started this particular clip? Hey, it's Cartier for K2 Vision RLE Refractive Lens Exchange. That rainbow I could not see until I had the procedure done. The doctors at K2 Vision have done refractive lens exchange procedures over 150,000 times. If you go to K2VisionRLE.com, set up your free Zoom consultation, you could be spending your later years looking at scenes like this without any prescriptions, no glasses, no bifocals, never changing a prescription, and never ever a cataract. K2VisionRLE.com. It's a vision quest. Dig the splendor of Shoshone Falls, Idaho. K2VisionRLE.com.
I just got to the point where my lifestyle, the activities that I like to do, I've always compensated for the glasses, and having this procedure now allows me not to have to consider that part. So, kind of an adventure-seeking person, so skydiving and scuba diving and hiking, all of those type of things, glasses just tend to be a challenge. And so with that, this has been a life changer, it really has. It was actually very quick. I went through, I felt very comfortable in the actual surgical suite, and recovery afterwards was very nice. The most amazing point, though, was the following day when I woke up and had really good vision without glasses, and the follow-up piece of my exam, they were telling me I had 20/20/2015, and that was without even further adjustments. I'm trying to withhold the jubilee I feel in having these new set of eyeballs, as some of my friends have stated. It's great. I don't have the glasses aspect. I am able to, my vision has the clarity of a child, like even a toddler. Truly, the colors are so much more vivid and bright. My vision is amazingly fantastic. I'm able to see birds out in nature and things that probably I would have missed. Freedom is a great way to explain how I feel without glasses. Freedom in and of itself is what you experience when you don't have to wake up and fumble for your glasses in the morning. It absolutely has changed my life. It's improved my confidence. It's given me a clarity of, I'm very excited about this process, so I'm thinking I might be even at a loss of words to explain how happy I am with everything. Having the RLE process is one of the best decisions I've ever made.
What is happening to those people that are over the age of 40 right now what's going on that's maybe causing their vision to not be as good? What are they experiencing? And anything you'd like to color up, please.
Sure. So LASIK, most people are familiar with it. It's been around for about 25 years. And for those patients who are younger than 40, almost certainly LASIK or PRK or an implantable contact lens would be the preferred technique for you. If you're between 40 and 50, it's possible that LASIK may be a good option for you. But if you're above 50, generally speaking, a refractive lens exchange is beneficial. And why is that? Well, the lens in the eye gradually ages throughout your lifetime, beginning in childhood, moving through your 20s and 30s and 40s. The lens in the eye begins to stiffen, and one loses the ability to change focus from distance to near. And it becomes increasingly difficult, usually around age 40, to read up close or to see fine print. And that's when most people will begin to either develop a need for bifocals or reading glasses, assuming there's good clear distance vision with either contact lenses or natural without anything. So as the lens continues to age, by about age 55, that aging is complete, and the lens has lost its utility in terms of providing any range of vision. And it really makes more sense just to replace that aging dysfunctional lens with a clear lens. And there are a number of different implants that are available. The implant technology has improved dramatically, especially in the last 5 to 10 years. And now with some of these newer lenses, particularly the multifocal lenses and extended depth of focus lenses or light adjustable lenses, we're able to greatly reduce, or in most cases eliminate, the need for both distance glasses and the reading glasses. So that makes this a very popular procedure for patients who are 50 and up. We generally don't like doing LASIK for people, or excuse me, LASIK we don't like doing for patients over 50 because they're starting to get a little bit closer to the point where refractive lens exchange may be needed. But for the right person, LASIK can still be done throughout the 50s or potentially even 60s. But under age 40, a refractive lens exchange is very rarely indicated. And the reason is the lens is still young and healthy and supple, and one's able to change the focus from distance to near without much effort. So depending on a patient's age, there's usually a solution that can help to reduce the need for glasses. And following a consultation and evaluation of the eyes, taking into account all of the anatomical features and the prescription, the patient's age, et cetera, we're able to provide a recommendation that's customized for each patient.
Sit up. Swing those legs towards me. Then you can open your eyes. How are you feeling? Good. Good. Can you see the clock? Oh my God. Crazy.
Yeah. Congratulations.
Was it painful?
No. God, no. That was amazing. Holy I haven't been able to see like this in so long.
Maybe before we get into that question, what is refractive lens exchange, and why is it the preferred procedure for those of us in that more seasoned years of their life, please?
Yep. So refractive lens exchange refers to removing the natural lens of the eye and replacing it with an implant. Why would we do that? It's because the lens has failed. At some point in all of our lives, our lens loses that elasticity and eventually the clarity, and we're more dependent on glasses the older we get. So if you're watching the webinar right now and you're trying to decide, do I have my glasses on or my glasses off? That's a natural consequence of usually being over 45 and most often over 50. And that means that your lens has gotten to the point where it can't focus anymore. So there's really two options. One, you can wait until you get a cataract and have that lens removed when it becomes cloudy. The other, you could wear glasses or contacts. Or I guess there's a third option, which is removing the lens before it becomes a cataract and replacing it with one of the new technology implants. And that is 100% of what I do. And that's all I do pretty much every day. So I'm happy to talk about all of the options and what the technology does. I think what we do best at K2 Vision, since we have the highest volume of using these lenses of anybody in the country, and we keep our data so that we can give patients a really good idea of what their expected outcome is, the range of the outcome, the appropriate lens for you. And it's not the same for every person. So that's, I think, really where we shine and what we do the best.
Oh, hi everybody, John Curley here. Let me show you how I used to practice playing the piano before I went to K2 Vision and had RLE, refractive lens exchange, where we got perfect vision now, by the way. I'm over the age of 50 and I had to wear these stupid glasses to read the music, so I'd be like this. See? And if I wanted to look down to make sure I was reading the right note, I had to take the glasses and put them down and then put them back up again. That's why I'm such a horrible piano player. But now I've got 20/20 vision and I don't have to worry about getting cataracts either. RLE, refractive lens exchange at myk2vision.com. Check it out.
If you'd like to get rid of your glasses, contacts, or readers and never develop a cataract, please schedule a free consultation with us today. Hi, I'm Dr. Andrew Kopstein. At K2 Vision, all we do are lens procedures. Our exclusive focus on this one specialty allows us to use the newest technology to achieve your best possible vision. With the 3 premium lens technologies that we use at K2 Vision, we've done more procedures than anyone else in the country. Our highly skilled team of surgeons have already completed over 150,000 premium lens surgeries. We have the experience to tell you if it's your right time for refractive lens exchange.
Getting LASIK, it honestly changed everything. Like I can wake up now, I just wake up to see. I can like lay down and watch TV without messing up my glasses. And I had huge frames because my vision was so bad. So it didn't change much except just like, I don't know, confidence, I guess. I have a lot more confidence in doing a lot of things now. Like I'm more active now. I kept seeing ads on my Instagram about LASIK and people getting LASIK. And I was just like, I've always been scared of it because it's like someone doing surgery to my eyes. So I was like, I said, let's just do it. Cause I seen an ad and said it was a discount. I said, all right, I'm just gonna send it. I called, I made an appointment like a month ahead. So I was like, now I can't back out of it. So I just sent it fully. Honestly, I've never known not having glasses. I've always had glasses. Like elementary school, I had the Harry Potter frames. I always had bad glasses. It was like 15 seconds per eye. It was like really fast. They said, all right, we gonna put this on your eyeball and it's gonna keep it open. And it's like, okay. And once I got right, it was just, all right, you're already next eye. I was like, that fast? I was like, is it done? He's like, yep. And then they went to the other one, another 15 seconds, done. I can play basketball, no glasses falling off. I don't gotta like wash my face. I can lay down and watch TV without having like my glasses bending while I'm laying down, you know. Shower, I can swim now. It's everything. I'm an active person, so it's just huge. I'm already telling people all the time. I'm telling them, I know it's scary because I was scared too, and I'm the biggest scaredy cat I know. So you can do it. Once you do it, it's like what, 30 seconds of fear for 20 years of no glasses. 30 years of no glasses is worth it. LASIK has given me the freedom to be confident in myself. Yes, LASIK changed my life, and it's the best decision I ever made.
Kopstein, of what actually happens when they come into the clinic. So they schedule that initial consult. What are we doing? What's actually happening? What's that experience like, please?
Yeah, when you arrive, we bring you first of all to a room where we have 5 or 6 different technologies that will tell us everything that we need to know about your eyes. So that's the physical nature of your eye from the front to the back, the curvature of your cornea, the distance between your cornea and your lens, the length of your eye. All of these things will tell us, will guide us to, number one, what is the proper technology for you, and number two, what what power of lens we need to get the light into the best focus to the back of the eye. So once we do that, that's about a 15-minute procedure. Then we bring you to a room, and all of these things are non-invasive. So we're not going into your eye to do this. These are all with optical technologies. And then when you come into an exam room, we dilate your eyes, and we typically show you a video about the journey of refractive lens exchange. Once you're dilated, then I will see you and I'll look at your lens and we'll have a discussion about what implant might be best for you. We'll talk about any other disorders of your eye or your visual system that is getting me to, or is prompting me to suggest one particular technology or another. And then mostly I'm just sitting there and answering questions. We'll give you as much time as you need, basically. We intentionally keep our schedule light so that I have as much time as every patient needs to answer every question, and we're never in any hurry. So the overall time that you should be in our office should be about 1 hour to maybe an hour and 15 minutes, assuming that we're running on time, which is, most of the time we're running on time.
Hey everybody, a little behind the scenes for you. So we're at Chesapeake Bay Wine Auction. Look how big this room is, right? This is the last seat right here. I don't need glasses. I can see from that stage. Here, I'll show you. 20/20 vision. I don't wear glasses anymore. I can see everybody, every bid card, from way in the back of the room all the way to the front of the stage. You know why? Because I went to see Dr. Kopstein in my K2 vision, and I can see every single card. Look at that. 20/20 vision, all that light coming in the back. Thank you, Dr. Kopstein. Thank you. No more glasses. MyK2Vision.com.
Hey, where in the world is that Cartier guy? World Heritage Site, La Alhambra, Granada, Spain. K2VisionRLE.com. Never, ever a cataract. No readers, no cheaters. You ready for a permanent solution? You want to see spectacular sights like this as pristine and clean as possible? Well, talk to the surgeons at K2 Vision RLE. They've done 150,000 plus of these exchange, making 150,002 of these procedures. Because I was one of them, and I'm so glad I did. Never ever a cataract, never a change of the prescription, no readers, no cheaters, and the doctors at K2 Vision, I mean, how is it different than, say, LASIK? There's a big difference between RLE and LASIK. They'll tell you about it on the Zoom consultation. Make it for free at K2VisionRLE.com. At the end, no readers, no cheaters, no contacts, never a cataract, and your vision can take in things like this for the rest of your life. K2VisionRLE.com. Adios.
How has your life improved since your LASIK surgery with Keen LASIK?
It's improved significantly. I don't have to worry about reaching for my glasses in the morning or worrying about where I left them at night.
What was the recovery process like for you?
Fairly simple. 1 to 2 days probably, if that. The first day was probably the hardest, but as long as I'm keeping up with my prescription, eye drops and artificial tears and following post-op care, it's fairly simple.
Is there anything you'd like to share with others considering surgery based on your experience?
I definitely 100% recommend coming to King LASIK. They take care of you, they treat you like family, and they're always checking in to make sure if you have any questions or if you're nervous or anything like that, they're 100% take care of you throughout the entire process.